Hello, everyone. Good morning, afternoon, evening, to wherever you might be joining us from. My name is Glenn Cole, and I am an education associate here at the Sing Health Duke-NUS Global Health Institute, where I work with the Global Mental Health team. And with the team, we host the Asia Hub of the Mental Health Innovation Network. So that's the logo in the middle you'll see there on the screen. If you're not already plugged into the network, I do encourage you to scan the QR code on the screen here or go to mhinnovation.net to come and join us. A lot of our work at this time is in encouraging knowledge exchange across the Asian region, finding ways to spotlight existing mental health innovations, support further innovation, and really represent Asia as best we can in the global mental health conversation. So hopefully you'll want to join us, or if you have not already. Just some pieces of housekeeping. You'll see on your Zoom bar that there is a Q&A button. So please feel free to use that to ask any questions to our presenter along the way. We'll try to get to as many questions as we can closer to the end of the hour. The recording for this webinar will be made available on YouTube after, and we will share the link through the MHIN website and through our upcoming Asia Hub newsletter. So that's another reason to sign up to the network, where you'll receive our quarterly newsletters for the Asia Hub. And in these newsletters, we try to spotlight innovations and organizations from the region, compile various resource documents, talk about upcoming events and opportunities, blogs from our members and collaborators, and that'll be all in one place. Okay, that all said, thank you again for joining this webinar today titled From Conversations to Guidelines, a Shared Journey Towards Responsible Content. I'm very happy to introduce Puan Mediha Mahmood, who will be sharing about the development journey of the Suicide Content Guidelines for Malaysia, which was released just this past June. Mediha is a regulatory and legal professional with over 20 years of experience in law, policy, and content governance. She is the CEO of the Communications and Multimedia Content Forum of Malaysia, or Content Forum for short, where she led the organization's rebranding and the nationwide revamp of the content code in collaboration with industry, policymakers, and the public. A strong advocate for digital well-being, Mediha has championed initiatives on online safety, digital literacy, and suicide prevention. And she co-led the development of these content guidelines with the Ministry of Health, the media industry, and mental health experts. And she presented this initiative at the 2025 International Association for Suicide Prevention's World Congress in Vienna, which is also where she and I had the pleasure of meeting in person. Her work focuses on equipping media, content creators, and the public with the tools to engage responsibly in digital spaces. And with that, that's enough talking from me. I will hand the time over to Maria, please.
Thank you. Thank you, Glenn. All right. So just as Glenn mentioned, today I would just like to basically take you all with me on this journey that we went through in Malaysia. And this journey was where we had conversations with editors, influencers, clinicians, and many others, which slowly grew into what we now call the suicide content guidelines. Now, this is also a very Malaysian story where there's, stories about faith, culture, law, and lived experience, everyone coming together, and sometimes uncomfortably, but always with the shared goal of protecting lives. And if there's one thing that we learned along the way is that these guidelines are never just documents, they are relationships in writing. It's shaped by the people who built them and carried forward by the people who choose to use them. So what we will do is let me just set the stage. We'll travel in 4X. So first of all, I'll talk about why the guidelines were needed here in Malaysia, the urgent problem that we saw in the content ecosystem that I believe we all now live in and see as well. Secondly, is to talk about how we built them, the journey itself. Thirdly, we'll talk about what's inside, the tools that maybe you could probably use if you intend to use them. And finally, what changed us in this process or in this journey, the lessons that we learned, the missteps, and what's next. So you can think of it as a play of sorts.
Hey, Maria, just to chime in, I think you
Yeah.
might need to reshare your slides.
Oh dear, what happened?
Sorry, I took over the screen share earlier.
Yeah, okay, let me see. Okay, this I will try and do that again.
Apologies.
No worries. I think it's this one. Did it work? You know.
It is loading, and yes, here we are.
Okay, great. All
Yeah.
right, so where was I? So anyway, so at the end, as I was saying, we'll take it as a play. There was this tension in it. There's characters, and yes, there's an unexpected plot twist as well in the middle. All right, so before we begin in earnest, I think what I can share is perhaps who we are and where we're coming from. So in Malaysia, we regulate content in a way that might be a bit different than most countries. So instead of relying purely on top-down laws, we use what's called self-regulation. And this is built into the law itself. Under the Communications and Multimedia Act, the this framework is such that there are industry forums which self-regulate or allow the industries to self-regulate. Our sister forums include, let's say, the Consumer Forum, and we also have the Tech Forum and the Postal Forum. But for us, the Content Forum, we bring together everyone with a stake in the content ecosystem. So we're talking about industry players like broadcasters and advertisers. We also have civil society organizations, many academicians, and even members of the public. So they sit down together with us at the same table and set the standards by which we all live by. And these standards are in a code that's called Content Code. Now, the reason why self-regulation is very important to us in Malaysia is because of the agility, especially when we're dealing with topics as sensitive and urgent like suicide. Because you see, there isn't much law that tells us or tells people how suicide should be reported or shared. There's no legislation about that specifically or how content needs to be treated. But around the world, and I believe most of you would know this by now, is that research has made it very crystal clear the way suicide is reported and shared can actually influence suicidal behavior. So, in other words, content about suicide can cause suicide. Now, that's not just a theory, I think it's a documented fact. And because of that, most of the attention has always been on the newsrooms when we talk about content. Because, after all, newsrooms are seen as the first responders when a suicide story breaks. But the fact of the matter is, decisions in newsrooms are made in seconds. So a breaking news headline or a photo or a caption, all these are choices that are locked in very fast and very often under really immense pressure. So the point of us in our self-regulatory framework here coming up with these guidelines for suicide-related reporting is not to police the journalists, and we made this very clear from the very start, because the last thing media wants to hear is the word censorship. So it's not about policing them or controlling what they can or cannot say, but it's to give them the tools that are quick and practical that will help them make these choices under pressure. But I'm just sharing a quick snapshot for those of you who might want to know who we are in the Content Forum. Some of these logos might be familiar to you. Like I mentioned, we have broadcasters, advertisers, media owners. Some of you might be asking, why do you see logos like McDonald's or Nestle up there? Those are brands who are taking it very seriously when it comes to ethical advertising. So they've joined us as well. So we've got one of our latest members is TikTok, joining from the social media platform. Essentially, we try to have the whole ecosystem in here because our job is to build standards that people believe in and also that the industry help write the content code. And we believe this is why self-regulation in the content industry is working, because it belongs to industry and to the community as well, not just to policymakers. So now going back to why we started our journey. Now, in 2023, just a little bit of stats here, Malaysia recorded about 1,087 suicide cases, which is a 10% increase from the previous year. But even that number doesn't really capture the whole truth, because experts tell us that the real rate is much higher because suicide is still underreported. Now, family members sometimes avoid reporting it as suicide because of stigma, because of religious sensitivities, or fear of shame in their communities. So behind every official number, there are many untold stories. And then came a turning point in May 2023. Parliament repealed Section 309 of the Penal Code, which for decades had criminalized attempted suicide. So decriminalization shifted the entire conversation. So suicide was no longer seen through the narrow lens of crime. It was reframed as it should be, as a health, social, and human issue. And it allowed us to start talking openly about prevention, support, and compassion. and not punishment. And this is where we believe that content played a very critical role. Because once suicide is recognized as a health issue, the next question is, how do we as society respond? And the way we talk about suicide influences whether someone feels safe to seek help or whether they continue to suffer in silence. And we knew as a content form that we had to play a role in guiding the narrative the right way. So in 2021, just taking it back a little bit, right at the height of the COVID pandemic at the time, we were already in the middle of updating our content code. So during the public consultation period for this, we started hearing a recurring theme. And this was from many mental health practitioners out there who were urging us to include a provision on how suicide-related content must be reported and shared ethically and responsibly. Now, it really wasn't just a suggestion, I would say. I think it sounded more like almost a plea because they were seeing at that time firsthand how the wrong words in headlines or the wrong images on screens were amplifying the stress at a time where the nation was already very stretched thin. So the question for us became very clear. How do we help the media help us? So how do we create something that allows journalists to do their job, to inform the public, to report the news, but to do it in a way that protects vulnerable lives at the same time? Now that question, that balance, became the compass that guided every step of our journey. And in that step, we constantly face the same question because when we go out there, we're equipped with the knowledge that our friends in the mental health industry or mental health practitioners have told us that you shouldn't have too much details, etc. It goes against the very grain of journalism. Because for journalists, one of the first things that they are trained to do is to find out all the facts. So they question us. If we can't report the who, the where, the why, or the how, what can we report? So this was something that we included in our journey for advocacy. We begin our advocacy initiatives with the media. For example, sharing here is a strategic partnership that we had with the National Press Club and MCMC, which is our regulator, where we launched a nationwide training series across 10 states in Malaysia. So we engaged directly with hundreds of editors and journalists, from the largest newsrooms in Kuala Lumpur to smaller local outlets in places like Kedah, Sarawak, and Johor. Now, we did our very best not to make these into the usual formal workshops, but we engaged in real conversations. So we heard how editors shared the impossible pressures of breaking news, how journalists admitted that there's a tug of war between wanting to do the right thing, but the race for clicks, especially these days. And also, very importantly, we also heard from medical practitioners who explained very often with very moving stories and examples the very real harm caused when details are sensationalized by the media. Now, I can share with you that these sessions didn't just train the media, it also shaped us too, because they helped us understand that guidelines had to be both clinically sound and newsroom ready. Now, by the time we moved into 2024, this work had scaled into something much bigger. We had conducted, I think, 97 sessions. Hundreds of people were trained, from newsroom editors to regional reporters, from teachers who were also considered influencers in their field to influencers, actual influencers in social media. And we knew that this couldn't be done alone, so we partnered up with platforms that shape the way Malaysians communicate today. So we had partnerships with Google, with TikTok, with Meta. In many ways, there were dialogues, there were panels, workshops, and they didn't just come in as observers too, they became collaborators. Because for social media platforms, as most of you might know, their community guidelines also include specific provisions prohibiting content that encourages suicide or self-harm. Now, from all of these conversations with all of these people, we came to realize that we can't just tell people to report and share ethically and responsibly, because it's very general. We needed to provide them with guidelines on how to do so. So at the beginning, and these are our suicide content guidelines, at the beginning, our focus was very straightforward. We were preparing guidelines for the media on how to report suicide ethically. And that made sense because newsrooms are, as I mentioned, the front line of these stories. And most of the references that we found globally had the same focus on media reporting. But just as we thought we were done, and we were very close to our deadline by then, When the media guidelines were very much nearly complete, a bigger realization emerged, and that was that suicide-related content isn't only shaped by journalists now, it also lives in the stories told by influencers, the scripts written by filmmakers, even in the deeply personal posts of those with, people with lived experience who want to share their journeys. So the decision was made to expand these guidelines beyond the media to include everyone that we could think of in the content ecosystem, from traditional journalists to creators, from teachers to storytellers, anyone with the power to influence conversations about suicide. So that shift transformed the project from a set of media guidelines into a comprehensive framework for all of us. So that brings me to what I like to call the power of an honest broker. So when we set out on this journey, we realized quickly that there wasn't one single group that owned the conversation about suicide-related content. Instead, that there were different. Instead, there were different tribes, each with their own priorities, their own language, and sometimes their own blind spots. So, for example, on one side, we had sorry, my slide just left. Okay. On one side, we had the mental health practitioners, the clinicians, the psychiatrists, the helpline leads. For them, every word had to be evidence-based. It had to be rooted in science with zero compromise on harm reduction. So their priority was harm reduction and clinical accuracy. Then we had families and loved ones, parents, siblings, survivors. Now their voices reminded us of dignity. They wanted to make sure stories did not turn their grief into spectacle, but also that the public could still understand the scale of the issue. In another corner, of course, are the newsrooms. Now, journalists told us very plainly, we don't have the luxury of time. We are in a race against the clock, and if we don't publish this, someone else will. The point of the matter is media is now really striving for the attention of the clicks or the eyeballs, and they live under such intense pressure where speed and clicks often dictate survival. So finally, there were the platforms. Now, these guys, for them, the challenge wasn't just one story that they had to look at. The challenge was how do I say this? The challenge was they had to look at millions of posts every single day. And this scale was, well, it's still considered unimaginable. They needed rules that were simple enough to address these challenges. Now, each of these tribes came with good intentions, but left alone, they would talk or they would often talk past one another. Clinicians didn't speak newsroom, platforms didn't speak family, families didn't speak policy. So that's where the content forum stepped in as the honest broker of sorts. So our role wasn't to impose one person's view on top of another or one group's view over another, but to help them find common ground and build shared solutions that could work across all contexts. Now, I can confess that it wasn't easy because just imagine being in a room where everyone has a megaphone but no translator. But that's exactly why we exist anyway, to bridge those divides and make sure that the end result is something that's not only ethical and evidence-based, but also practical, humane, and scalable. So I guess I can tell you that once we had all these voices at the table, the question was, how do we make decisions? What do we anchor ourselves on when everyone has strong views and different priorities? And I can also share at this point of time that we had separate meetings as well with these groups. And we also had one where everyone was together. But we came back to a set of design principles. Essentially, it's like our compass. What you see here on screen aren't just art slogans. Like they were the test for every draft, every debate, every word that we wanted to put in the guidelines. So the first one is nothing about us without us. So this meant lived experience wasn't an afterthought. Too often, we've seen people with lived experience are only brought in at the end as a checkbox. But what we did this time around is we flipped it. They were in the room from day one, shaping the guidelines alongside the industry and clinicians. The second principle was evidence plus local reality. Now, global research is, of course, invaluable, and there was a ton of which we were referring to. And we leaned heavily on WHO, UNESCO, the international suicide prevention studies from around the world. But science alone isn't enough for this because I think in some other countries as well, in Malaysia, culture, faith, and language also shape how these stories land. We also needed to consider the multi-faith communities in Malaysia who also have sensitivities that needed careful handling. So we had to blend global best practices with Malaysian reality. Now, the next is the clarity beats poetry. Now, this one came straight from the newsrooms. This was a common thread among all those journalists and editors we spoke to. As one editor very bluntly put it, I'm not going to check your guidelines each time someone dies by suicide. Just tell me what to do and how to do it. So the guidelines had to be written in language that was clear, sharp, and practical, and not academic. And finally is the principle, not finally, the before that is the principle of do before don't. This is where instead of saying, which is very often, we tell people what not to do, we showed them what they should do. So this was where we gave checklists, we provided side-by-side rewrites examples, and because we realized that preventing harm is easier when people know what the safer alternatives are. And finally, dignity always is a core design principle, whether it was images or headlines or references to minors, dignity also became our North Star. Now, these principles might sound simple, but they grounded every decision, and they were the bridge between clinical science, newsroom deadlines, cultural realities, and the human need for empathy. Now, when we first set out to create these guidelines, our instinct was, of course, to sit down and start drafting. But we didn't. Our first few months were not about writing at all. It was about listening. And the idea was simple: start where the people already are. So we didn't go out of our way to organize big consultation sessions with everyone. Instead, we wove this listening into the activities that we were already doing. So in content forums advocacy work, we naturally meet so many different groups of people. So we meet editors and reporters, producers, platform team, policy teams, clinicians, teachers, parents, students, all of it. And we also met people with lived experience. So through these natural encounters, we began to hear the full spectrum of perspectives. So the newsrooms, like I mentioned, told us about the impossible pressure of deadlines. This was repeated to us many times. And then clinicians shared about, the weather effect and the Papageno effect. Families and young people reminded us of the weight of stigma and the language people actually use online. And two voices, I think in particular, really stayed with me during this session. And one of it was the young creator who said that, I have experience in suicidal ideation and I want to share my story, but you need to tell me how, because I don't want to risk harming others. And then there was also a journalist who admitted that they want to be responsible, but they can't help but notice the irresponsible ones are getting the clicks. This is very simple. Simply put, we have media who is responsible in not showing pictures of what happened, but the same images are being shared across social media platforms or even on instant messaging platforms as well. So this was the frustration point for a lot of journalists. Now, these honest reflections reminded us that before we could prescribe solutions, we have to understand their realities. And that understanding came not from a formal process, but from the conversations that we were already having in our day-to-day work. Now, when it came to building the guidelines, we knew they had to be evidence-based or evidence-anchored. Like I mentioned earlier, international research formed the backbone of our approach, and decades of studies on suicide contagion and prevention gave us the science we needed. That was non-negotiable. But the words, the tone, the cultural context, these things matter just as much. And in Malaysia, we realized that the stakes are even higher because of language. For example, take the English word suicide. It's clinical, it's somewhat neutral, but in Malay, the term used is bunuh diri, which literally translates to kill self. Now, this is considered to be blunt, it's quite harsh, and it carries centuries of stigma, especially within faith-based communities. So that's why we had to carefully look at localizing the language as well to make sure that the guidelines were scientifically sound, but also socially and culturally adoptable. And so with this foundation, we moved into the drafting stage. But drafting wasn't as simple as writing a document in an office. It was messy, it was deeply collaborative though. And we wrote, we tested, we rewrote, and always asking, does this make sense to that journalist with the deadline, or that creator on Instagram, or to a teacher in a classroom? That's where the next phase of this journey began. When it came to drafting, we treated it like a living experiment. We started with a draft, we pulled together all the research and expert input, then we put it to the test with real world simulations. We would ask in our workshops, what headline would you write? What image would you pick? What caption actually works for a 50-second reel? If you're an editor and you get this story and you need to have a headline, we understand you want it to be not clickbait, but you want it to be attention grabbing. How do you do that without having usual clickbait terms in it? Now, every single time we did this, we very quickly saw the problem. List of prohibitions didn't work. People don't want to be told only what not to do. They needed the checklist. They needed the side-by-side examples. They needed the templates. So we redrafted again and again. After that, it went through a public consultation period. And the public consultation period turned into something, or turned the guidelines into something that's much richer, more layered, more humane, because then we heard about how families would share that certain phrases would reopen wounds. Some journalists also told us that certain rules will be impossible under a deadline. There were conversations about, if I can't show pictures of the scene, I can't show pictures of the deceased, what can I show? So there were conversations about, what kind of symbolic pictures you can use, pictures of first responders, that kind of conversation. We also had situations where creators or content creators pointed out where our examples didn't match the realities of social media. Because if you're not a content creator, you're not really aware of how the algorithms would work or how your content can be boosted up or amplified. So they shared with us, and each of these perspectives left fingerprints on the final document. So that's why I always say that the guideline we have today isn't just ours, it really does belong to everyone who contributed. Now, let's open up the guidelines themselves, starting out with the general guidelines. Now, this section is the backbone because it applies across all platforms. Whether they're writing a news article or posting on social media or producing a short video, these principles are the foundation. Now, I will go through one by one, but they do cover the essentials: how to handle method and location responsibly, how to present suicide news independently without unnecessary drama, how to balance the complexity of suicide so it's never reduced to a single cause. Now, they also remind us to include warning signs and resources because reporting a tragedy without pointing people to help is a missed opportunity. And they also ask us to highlight prevention and recovery, not just loss. The general guidelines also speak to the craft of content, the images, the headlines, the placement, the narrative, even infographics. Each of these, we say, can either uphold dignity or cause harm depending on how they're used. So each of these hexagons, I think they're called, that you see here came with its own provisions. Now, the best way to think about the general guidelines is that they're not about restricting what you can say. They're about helping you say more responsibly in a way that informs without sensationalizing and that leaves the audience with hope and options, not despair. In other words, these are the common sense guardrails that help everyone, from journalists to creators, to do their work ethically while still doing it well. Then we came, with part A of the specific guidelines. This is after laying down general guidelines that apply to everyone. Here's the specific guidelines, which are tailored for media practitioners and publishers, because their work often comes with unique challenges. And they're the ones who have to make judgment calls in difficult, often high-pressure situations. So here, we went deeper into scenarios that demand extra care. For example, how to interview survivors and families with compassion, how to handle unusual circumstances or mass killings, and how to report when young people are involved. We also address particularly sensitive areas like celebrity suicides and suicide in multi-faith communities, where the ripple effects can be quite complex. And one area we felt very strongly about was the statement of death by officials. Now, this came up very often in our consultations because many reporters would tell us, we're just quoting what the police or authorities said, or we're just covering the PC where they said this, or they showed this picture. And they weren't wrong because for years, for decades, official statements sometimes included unnecessary details like method or location, even photos and suicide notes. Now, once those details are out in the official press note, journalists feel they are simply doing their job by reporting them. But we know from global evidence, and sadly from experience here too, that amplifying those details can increase risk and trigger limitations. So the guidelines remind us that being accurate doesn't mean reproducing every single word uncritically or every single images that are being shared with us. So we we basically let them know that even if information comes from an official source, it still needs to be filtered through an ethical lens. So editors and journalists become the frontliners for this to make sure that such details don't get to the incidents. Now, we also included guidelines for reporting on self-harm, and importantly, something that we often overlooked, guidelines or provisions supporting journalists themselves after covering traumatic events. Because trauma doesn't only affect those in the story, it affects the storytellers too. And I have to really give credit to the psychiatrists and mental health advocates who joined us in the working group because this was something that they suggested very clearly, that there needs to be clear guidelines on how to find support after covering traumatic events. So the goal of these specific guidelines, again, is not to restrict reporting. It's to give media practitioners practical situational advice for their toughest moments so that they can inform the public responsibly while still protecting dignity. For the media protectioners, the most powerful tool they have, and we tell them this all the time, because it's also sometimes the most dangerous weapon that they can have, is their words. So a single headline, a caption, or even one phrase can shape how society understands suicide. And that's why this part of the guidelines focuses a lot on the language that reduces harm. And a simple test we use is this: will this sentence increase pain or increase options? Because if it increases options, things like help resources, coping strategies, or hope, then it earns its place in the news report. And to make all of this practical, we introduced something very simple, which is the red, amber, and green content map. Think of it like a traffic light for suicide-related content. So red is what to avoid or remove altogether. Things like explicit method details, images from the scene, suicide notes or narratives that can glamorize the act, which can do real harm. So this is red. Amber is where extra care is needed, like celebrity cases, anniversaries, speculation about causes or motives, or even comments under viral posts. So these aren't automatically harmful, but they carry risk depending on how they're handled. And finally, green is what we actually want them to amplify, which is recovery stories, help-seeking journeys, community support. So these are the stories that create hope and options and really should be in every news report or every story. So this simple traffic light map thing became our shared shorthand they really wanted, which is across newsrooms and for creators. It's quick, it's easy to remember, and it helps people make better choices under pressure. Now, let's look at specific guidelines part B. This section is tailored not for traditional media, but for the wider group of people who create and share content every day on Instagram, on TikTok, on YouTube, podcasts, or even just their own personal Facebook page. So we identified three key groups here: social media users, those with lived experience, and influencers. Why these three? Because they have a huge impact on how suicide is discussed online. And the message here is simple: you don't have to avoid the conversation, But when you do join it, or if you start the conversation about it, you must turn your platform into a space for support rather than harm. Now, for theirs, when we spoke to creators and influencers, one thing we heard again and again was that they couldn't stay silent when issues like suicide came up or it's become viral because they feel that keeping quiet might make people think they don't care. So they didn't want to stay quiet, but they also didn't want to get wrong. So we introduced this pause framework. So we've reframed it as don't just not share, but share responsibly. So we said you can use this, keep it in your notes app. It just says number one, pause before posting. Stop for a moment because when you're really riled up, you have strong emotions after reading something, that is something that could make you a poor editor of your own post. The next one is A, which is ask. Ask yourself when you're posting whether it's helping or is it adding shock or are you trying to get clicks? And then understand who's your audience. If you're a content creator with with a following consisting of children as well, you must think about whether it is suitable for you to be pushing such content. As a signpost, which is always signpost or point towards support, helplines, or even something as simple as how to help a friend or go see someone if you're feeling some sort of way. And finally, edit. Read it again and again if you can, and remove the method details or cut out triggering visuals. So this was something that we provided to them, and it's a simple tool that a lot of them are already using. Now, finally, we came to specific guidelines part C. Now, these were developed for drama, film, and documentaries, the storytellers who don't just report reality, but they create it on screen. And interestingly, this section wasn't in our original plan. It was actually suggested by a filmmaker through a broadcaster who was on our working group during our consultations. So they essentially said, news is one thing, but how about fictional portrayals? Because these can be just as powerful and sometimes even more harmful because audiences connect very deeply to characters and stories. And they were right, of course. Fictional content has the ability to glamorize or trivialize or to unintentionally trigger harm if it's not handled with care. For those of you who are in suicide prevention work, you would probably remember the Netflix series 13 Reasons Why and how it ignited a whole conversation about why such series need to really involve people who are subject matter experts so that it doesn't trigger contagion. So this part of the guidelines were designed to strike that balance for filmmakers to preserve their creative freedom, which is very important to them, but also to remind producers and writers of their responsibility to audiences because the way suicide is depicted on screen doesn't stay on screen. It shapes conversations, it shapes perceptions, and sometimes it also shapes behavior. So scenes like this are all too familiar in fictional content. Or, for example, woman on the floor, pills scattered, note nearby. It's dramatic, it's emotional, and it's often used as a storytelling shortcut. But the problem is that while it may grip the audiences, it can also trigger vulnerable viewers and contribute to imitation. So our guidelines on drama and film focus on shifting that narrative. Instead of glorifying or romanticizing the act itself, we encourage them to explore the real stories, the complexity of risk factors, the importance of help seeking, and the resilience of those who actually survive suicidal thoughts. Now, some of the key considerations, as you can see on screen, include showing characters who struggle but who don't go on to die by suicide, or portraying everyday lifelines like a friend, a teacher, or a mentor or colleague who can make a difference. Depicting not just the act, but also the grieving and healing of those who are left behind, and avoid misleading portrayals like, and this is what we often see in Malay dramas, how suicide is used as a way to punish others or somehow magically reunite families. Now, there was some protest that these changes feel like censorship, but we remind them that these guidelines don't weaken storytelling. They make it more compelling and more human and ultimately more responsible. Because, like, we essentially wanted the filmmakers to relook at the way how, not just the way they write the script, but the treatment of it, so that they have the power to be heroes in this space, not by avoiding these difficult stories, but not by exploiting them either. And These final considerations you see are also incredibly powerful because, for example, planning promotions carefully make sure that the marketing doesn't undo the sensitivity of the story itself, because sometimes that happens, especially when they cut it short to become a TikTok video or an IG reel. Then that's where it could undo every single thing that they've done for the actual movie or drama. And we talked about how trigger warnings can give viewers agency to let them decide if they're ready to watch. And most importantly, we really encourage them to consult experts and lived experience voice to ensure accuracy and humanity in the storytelling. Okay, so developing these guidelines wasn't a smooth ride. There were some very real tough spots that we had to navigate, moments where good intentions clashed with practical realities. So I'm sharing these with you. For example, naming the deceased. Journalists told us if we don't name, readers think we're hiding something. But if we do, then it risks triggering harm. So this was a genuine dilemma, transparency versus safety in some cases. Then there's the algorithms. Algorithms is where they don't care about intent. For example, if a post about suicide is to create awareness, it can spiral into a trend that can be harmful in its own way. We also consider the fact that young people use algo speak, which is coded language to bypass algorithms, because most social media platforms don't allow you to specifically talk in detail about suicide. Then they use terms like unalive, or they use the skull emoji. And this just showed us how complex digital realities are. Next, we have the user comments. Now, a story doesn't end with the headline because it lives in the comment section. And often those comments spiral into speculation or stigma or blame or glorification. So we realized that moderation plans had to include the below the fold space. Next is clinical frustrations. So these were all our friends from the mental health practitioners. They know what not to say, but many of them struggle to translate clinical caution into newsroom or creator language. So bridging that gap became to be our job as mediators. And speed versus accuracy, I think I've mentioned this challenge before. Our compromise was very simple. We say, put safe placeholders now. You can update with details later once you've had a clear indication of what should be shared or can be shared. And finally, religious considerations, because in Malaysia, faith plays a very huge role, and some communities carry legacy, stereotypes, and stigma around suicide. And this is something that we needed to look at. So each of these tough spots reminded us that guidelines aren't written in our boardrooms. They're born out of tension, out of compromise, and above all, a deep understanding or respect for the different worlds that we had to bring together. Now, as much as we tried to plan the guidelines, some of the most important changes didn't come from us. They came from the people that we were listening to. And these are the moments that completely rewrote our draft, like a senior editor asking for templates, like the filmmaker who asked, how do they make a safe movie about suicide, which then created or pushed us to insert an entirely new chapter on fictional portrayals. And there was also situations where journalists assumed that audiences want hard facts and statistics, but mental health practitioners reminded us that what they need are stories of hope and methods for help. So that's why we shifted the emphasis towards recovery stories and practical takeaways. And this is something that we heard from everyone, and is that they want to share helplines, they want to quote experts, but they don't know where to start. So this gap led us to creating two living resources, which are updated helplines and experts. Those two QR codes, those are living references for them to scan and get an updated list of helplines and also of subject matter experts, mental health practitioners who have agreed to be contacted for anyone to refer to if they need to have an interview, etc. So what truly worked in this process was that the guidelines was built with people, not for them. And that spirit carried through the launch of the guidelines itself. The guidelines were endorsed by the Ministry of Health, the Ministry of Communications, with the National Center for Excellence for Mental Health and CMH playing a significant role. And the most meaningful part of this launch was, for me, was who was in the room, because we had representatives from every side of this journey. and the journalists, the creators. And at this, I want to pause right here actually to acknowledge the working group members. I think some of whom may be with us here today in this very webinar, because having them with everyone else on the launch day was reminded that these guidelines didn't emerge from a closed door process. And we were also, like I mentioned, deeply honored to be given the opportunity to present this work in Vienna, which also told us that this model of co-regulation or co-creation rooted in self-regulation and inclusivity can also inspire beyond borders. And I think I'll just run through this. As proud of what we have achieved, it's just as important to be honest about what we do differently next time. So one big lesson was visual conversations need to be had earlier, because this is something what everybody asked for. Another is comment moderation. It became clear that this is something that we all need to work together with platforms. We also realized the value of front desk training, like assignment editors, producers, social media leads. They're the ones who needed to be trained early because they can set the right tone before the story snowballs. And finally, sector-specific modules. We realized that suicide intersects with so many spaces: sports, entertainment, education. So micro modules tailored to those contexts would probably make the guidelines even more practical from the start. And as we wrap up, these are just the few highlights that just use hijack because it rhymes with highlights that you can use to take into your own context. And the truth is, the future of content guidelines, I feel, doesn't lie in perfect rules. It lies in the strong relationships that enable the swift, safe, and compassionate responses. So if there's one thing I hope you take away from today, it's that content has power, and power to harm, but also power to heal. And every one of us here has a role in tipping that balance. So, yeah, I think I'm here at the end of our journey. Thank you so much for joining this journey. Thank you for being a part of this conversation. And because it's a conversation, I'm very happy to hear anything you might want to add or ask with regards to this.
Thank you very much, Maria. Like I said to you before, it's genuinely great to see how comprehensive these guidelines are, like beyond traditional media reporting guidelines. Also seems like the project grew a lot bigger than what the team had
Yeah,
initially set out to do. Um,
yeah,
and it's great that y'all were able to take on that challenge. Um, Something I missed out in our the initial like kind of opener for this is also like today is like World Suicide Prevention Day,
yes,
right? And the theme for the year for this year, and I think it's a 3 year set theme, but it's about changing the narratives of suicide. And so stuff like this is like really, really key. When we're talking about how, any sort of content really does shift the way that we think about suicide, the underlying, how we understand the underlying issues behind it, the stigma around it, and what the avenues of support are as well. So it's really, I was very excited for this webinar, personally speaking. Um, so I'm going to remind people again that there is a Q&A box. If you have any questions, we do have some time now to answer some questions. And while I give you all some time to do that, I'm gonna ask a little bit because I think one of the things with guidelines is also about adherence to these guidelines, right?
mm,
So I'm wondering if you have any sort of what are the sort of adherence mechanisms or like monitoring to see like the impact of these
yeah,
guidelines on the content that's being produced?
that's right. Okay, so I thought you'd ask that. So measuring progress. So I think for something as sensitive as suicide content, vanity metrics like clicks or impressions really don't tell us much. So what really matters is whether the guidelines, like you said, are being embedded into practice and whether they reduce harm. So for us at the Content Forum, compliance to these guidelines are like compliance to the content code. It needs to be done by everyone who's a member. But we are looking at also making sure that through our advocacy um, practices, that it reaches beyond that. But when it comes to measuring impact, we'll be looking at it through four lenses. Number one is newsroom integration. Are the guidelines adopted into newsroom SOPs or platform policies? Because for us, integration into the daily workflows is one of the strongest signs of impact. Secondly is training reach. We track the demand for training across the different groups from journalists to creators to educators. And the fact that requests are increasing tells us that the guidelines are not only relevant but hopefully needed. And the resource availability, we monitor whether helplines are or support links are being included or appearing more frequently in the published content because that's a tangible way to see if safe practices are being normalized. And finally, impact evidence. We collect case studies of safer rewrites. This is where sometimes they send us what they want to print, but they're asking us what can be done better. So instances where headlines or images or posts have been changed after we alert them to apply the guidelines. So this can track signals of actual reduced harm. So it's less about chasing the big numbers, and more about building evidence that these behaviors are shifting. So hopefully over time, these indicators will give us a clearer picture of cultural change, which in the end I think is the real measure of success.
Yeah, this is I guess some of what you just said is quite reminiscent of a project that's being carried out in India
Hmm.
that we're aware of. They have sort of a reporting scorecard, right? And they have like the positive and negative kind of behaviors and trying to score media out in
Yeah,
some ways and try as a means of like nudging sort of these like newsroom integrations and stuff.
that's right.
Um, I did did have a question on the side, it's not necessarily in the Q&A box, but I'm wondering a little bit about who funded the project and who's able to continue funding these projects. Because I think, if people want to adopt it into their own countries, like that might be one of the big questions.
Okay, so this was basically spearheaded and led by us at the Content Forum. The Content Forum is a nonprofit. What we operate by way of a grant. So MCMC, the Malaysian Communications and Multimedia Commission, gives us an annual grant to do self-regulation work, basically. So this was included in our plans. So we budgeted for it that way. But what also helped is, especially for the advocacy part, because the members are mostly, broadcasters and content creators and people with their own platforms, that helped us to get a better reach with minimal cost, if any. So that also helps. And I think I can share with you, Glenn, this is exactly what happens when they are invested in the guidelines themselves. So it's something that they can talk about and feel very much part of it. So we got a lot of mileage through that.
It's great to hear.
I mean, we welcome other funding, of course, but that's essentially how we operate.
Mm. We have a question in the chat, in the box around, I think actually this also came up in the forum, as in the World Congress session as
Mm,
well. But like, what are your thoughts around there being a lot of blame or accusation on mental health professionals? And I guess in this case as well, like I know that media professionals will also
yeah.
quite to blame sometimes in for not preventing suicide.
I mean, I don't have as much experience or exposure to this, but through the journey that we've done this, I realized that it's very easy for us to point fingers at each other, and I know mental health practitioners get this a lot. Similarly, the media practitioners are getting it a lot. And I think we all agree that there's no one person to blame because quite frankly, there are also structural and systematic changes that need to happen. Like we always say, there are multiple causes to suicide. There's no one particular cause. So it's also I think it's also quite unnecessary for us to try and find someone to blame for this. It's very hard. It's a case by case basis.
Yeah, so I guess it's also that bit of like how everyone involved can kind of work together to
Yeah,
really put the focus back on like what we're trying to do rather than putting it
that's right.
and trying to prevent. Um,
That shared goal thing. Yeah.
yeah. I actually really like the phrase you used earlier about the content forum serving as like the honest broker
Yeah.
in this. 'Cause I think even if it's coming from I guess because it's coming from an industry perspective as well, right? Some people might see it as like, oh, you're protecting the industry, but
Mhm.
this is like it is meant to be about self-regulation to
That's right.
to an extent. We had a question here from a group that's looking to organize a similar co-creation event focusing on safe reporting, and they'd like to engage a few key stakeholders in the process. So their goal is to create a more of a practical one-page guidance document on safe reporting. And they're wondering if you could share any tips or recommendations on key elements to include. especially since it's like the first conversation that they want to introduce. So
Right.
how do y'all approach your first conversations with the community as well?
We would pick, oh, no, I should say lowest hanging fruit, but we would pick the most important thing. And I think throughout my conversation just now, what was very clear to us that people needed to know what they need to do. Because quite often we have the don'ts. Don't put in this, don't put in that. But what they really appreciate is like what you're planning to do is create a one-page guidance document. It really helps if you tell them or guide them on what they should be doing. I think that's the main feedback that we've gotten mostly from editors and journalists as well. It's easier if you tell them use this a few list of headlines that they can use for suicide cases, for example, and also images that they can opt for, or the standard headlines, helplines that they can use. And another thing that we discovered, just because we give them the helplines doesn't mean that they will be able to share it well either, because the way they share, there are some newspapers who go, if you feel like you want to commit suicide, please call this number, which isn't exactly the safest way to offer helplines. So the wordings for that can also be offered in your guidance because it really does help them. They want to do right, they just don't know what right is.
Actually, this uh I had thought that I lost it. But it was something around like kind of like yeah, it is interesting to see how y'all worked it out as a checklist rather than
Yeah.
just like a do's and don'ts kind of thing. Um I actually oh yes, so the thought I had was kind of like going back to the quote that you had earlier about from one of the journalists that said like oh but the sensationalized ones are the ones getting the clicks,
Right.
right? So then how do you kind of because that's the reality of the situation in
Yes,
some
it
ways, right?
is. It is.
How do you foresee overcoming some of those?
It is going to be very challenging overcoming that. But I think the first thing that we wanted to do is to make sure that the ones who are being responsible don't spiral down to become irresponsible. So the message that we always send to them is that you guys, you journalists, you're professionals, you know the ethics. We want to elevate these guys to join your standards. We don't want to lower the standards to join them. And there are two ways to doing this, which is what we're doing, but also to make it very clear to social media users and creators out there, or people who are seeing these being shared, to report them. Because quite frankly, they are clickbait or rage bait, but why are we taking the bait? So we're always in our advocacy efforts telling people if you see such content online or on social media, please report it. We've reported it ourselves, and more often than not, it's taken down. So I think that is one way to again nudge that shift that we want to see. But it will be a great challenge, especially in this day and time when, as you know, everyone just wants something to be angry about.
Yeah, and I think like I think sometimes that becomes like another tricky piece to like advocate
Yeah,
because that could also come across as like policing and censorship.
exactly, exactly.
Yeah.
Very tough.
So it's a lot about reframing the work that we're trying to do in ways to prevent rather than to police.
That's right. That's right.
Yeah. Um, we're kind of at the hour, but I just want to answer this one last question here
Mhm.
and see if you have an answer to it. But do you have any examples of where like compliance to the guidelines of any form has in practice has helped to reduce the stigma in the population?
Okay, I wish this was something that we could prove, but I can give you it's anecdotal. But when we talk about there's a section on how to address suicide-related content in multi-faith communities. Now, I can share that for Muslims and some other religions as well. When we talk about suicide, it always links back to the whole it's a sin, you're going to hell, yeah, that kind of story. So the guidelines talk about how we should change that narrative into how if people who are in distress or who are having suicidal ideation, they can actually turn to places like mosques and temples who provide support for these kind of things. So instead of talking about sin and hellfire, we're trying to make sure that the focus is on how this is a public health issue and how there are support and helplines, how compassion is also very much an integral part of religion. So we've had these conversations, and I think it's moving the needle a little bit, but we need to have a lot more of these.
And that touches on a whole other aspect of suicide
Yeah,
prevention, right? Kind of engaging the religious leaders that do have a lot of influence and reach within these communities as well.
right.
And how do you get them on board with kind of as a public health issue rather than any other sort of issue?
That's right. Yeah.
Okay, well, um, I think that's all the questions that we have on the chat. There's someone who mentioned that they think that this work can also be applied to moderating issues on bullying and
Yep.
cyberbullying, which is definitely something that's on the rise as well.
Yeah. Agree.
But other than that, I think that's where we'll call it for this webinar. Thank you very much again to everybody for joining us today. Um, yes, if you'd like to connect with Mediha, that's her contact right there. I'll give you a few moments to check on that before I also then replace the screen.
Go ahead.
Okay. Before we close, I'm just going to share that if you like the work that we're doing here and the stuff we're trying to work on, we do have a course on global mental health in Asia that's offered through the SingHealth Duke-NUS Global Health Institute that is going to be running the end of January next year. The idea being we're talking about like pressing mental health issues for the region and getting people who like Mediha who are kind of on the ground and working on some of these issues to come in and share about what has worked, what hasn't worked, and kind of how do we formulate policy and practice around this space a lot better. So if you're interested, you can also scan the QR code, find out more. Registrations are open, um, and we are happy to answer any other questions. Um, and then thank you very much for joining us again. If you can scan the QR code as well and leave us some feedback, we would also appreciate that. I should have put a link in the chat, but I'm going to go and pull that out now. But yeah, we love to hear any feedback you might have about this webinar or like subsequent webinars and things that you want to learn and hear more about. We're here to also try to serve the communities in which we can reach and do that sort of knowledge share. But otherwise, thank you very much, everybody. Have a great day, evening ahead. And thank you very
Thank
much.
you. Thank you, everyone.